Welcome to today's presentation, Vaping Prevention and Interventions in Schools, the third and final webinar in our three-part series. We would like to note that today's presentation is provided free of charge and is available in the public domain. Also, the information presented today are the views and opinions of Dr. Erin Fisher and do not necessarily reflect the official position of HHS or SAMHSA. Please let us know if you have any questions about the information in this disclaimer. It is my pleasure to introduce our presenter today. Dr. Erin Fisher is a faculty member in the Educational Psychology Department at the College of Education at the University of Utah and works with schools across Utah to build and sustain contemporary behavior and social emotional programs, both in elementary and secondary settings. Dr. Fisher also has an appointment in the University of Utah School of Medicine's Department of Psychiatry, where he is the director of their pediatric feeding disorders clinic. It is my pleasure to turn the time over to Dr. Erin Fisher.
Thanks so much, Rory, and thanks everyone for joining me today. It's amazing to see so many of you here for this session as we are first doing it live. I know that this is the third part of a three-part series, and so you've been able to hear some amazing content up to this point around supporting prevention efforts around vaping. And today's presentation is really going to focus on schools and how we can consider vaping prevention efforts in the school setting. So for a quick overview, if you want to follow along with me, we're going to explore comprehensive school-based prevention approaches. There are many out there we can consider, and hopefully I can get you oriented into what works. We also want to build up some skills around developing effective strategies for resisting peer pressure and making informed choices. And this is really integral in our work in schools around prevention. And last but not least, I want to give you all some resources to support your systems and to really get vaping prevention actuated and implemented to the best of your ability in a variety of different school settings that you might serve. Like folks had mentioned earlier on, if you have questions, please jump in the chat. I'm happy to answer those questions, and I imagine that those will be relevant for many other folks who are attending as well. We have about an hour to talk through vaping prevention schools, and we probably could do a whole semester course on just this. But hopefully today, like I said, you're leaving feeling inspired and really just stirring your interest about how you could impact change within your communities. With all of my presentations, I'd love to get started by giving shout outs and recognitions to all the amazing folks that I get to work with here in Salt Lake City, Utah. We have the University of Utah Technology and Training Education and Consultation Lab, which is celebrating its 10 years this year. And we support schools and programs across the state, particularly around prevention efforts, mental health supports, and really empowering systems as a whole. And if it wasn't for all of these great folks who I get to work with, none of this would really be possible. And so if you're interested, I'd really encourage you to check out some more of our work. One of the main projects that I want to highlight that really kind of springboards into our discussion around vaping prevention in schools is our Utah School Mental Health Collaborative, which is a statewide initiative that really seeks to partner with every school within the state to build systems of support, these multi-tiered systems. And if you're familiar with MTSS, you know that this really speaks to prevention as a whole. And so what our project is really seeking to do is implement services that we know work to really enhance what's going on in our communities, in our school communities. We know there are great personnel within the schools, but there's a lot of pressure and not all the time to really do all the things. And so our job in our Utah School Mental Health Collaborative is to really help folks work smarter and not necessarily harder with the resources that they have or that could be available through the state. And so you'll see from this image here that we started with a few schools, but we've been rapidly expanding. And our goal is to really affect change in all schools positively around wellness and school mental health. And how we do that, like I mentioned, is we work through a system. And the system is really important, especially as we think about prevention and we think about vaping. If I was to say the parents are the only ones responsible to make sure that their children don't vape, that's a lot of pressure. Now, if I expand that bubble, like you see here, beyond the students and families, and now we have the education system, schools. We have all of the individuals who impact our children, who interact with our students. We can empower them to do prevention efforts. That doesn't mean they have to be a substance use prevention counselor, but they have to be aware and they have to be willing to learn and think about ways that they could use those skills within the model of the school that they already are working in. And then if we pull out even more to that 10,000-foot view and we have that third level of this system, this is where so many of us who are probably on the call today really fit in. If we're not already working in schools, we are community mental health providers or community prevention providers trying to support our school communities and our local communities. And you know, vaping prevention is important because it impacts so many of our youth, and we'll get to that in a little bit. So let me show a quick video. This video just describes a little bit about our Utah School Mental Health Collaborative and just about some of the services and supports as we get oriented into this prevention efforts in schools.
Hi, I'm Dr. Aaron Fisher, and I co-lead the Utah School Mental Health Collaborative. This is a statewide project created to improve the overall quality of well-being support and available resources at your child's school. We do this by providing schools the training and technical support to develop effective mental health systems. We provide training and support to educators and school administrators to effectively use screening measures to understand student well-being, plan and deliver school-wide social-emotional programs, assess available school well-being needs and resources, and connect with community mental health providers to support student well-being. We provide technical assistance by increasing the capacity of school personnel to use their existing resources to create sustainable and effective well-being and mental health systems within their setting. Our collaboration provides layered support, with the first layer promoting school-wide well-being, the second layer providing small group therapy and targeted supports, and the third layer providing individualized therapy connection with community support. When students receive these layered services, they experience better academic outcomes, stronger social connection, and increased well-being. Thank you for learning about our School Mental Health Collaborative. We look forward to working to support your school community. Follow us on social media to learn more about the Utah School Mental Health Collaborative.
All right, thanks everyone for checking out that short clip just around what we're doing. And I think it really highlights the system that we'd like to see in schools. And it's very easy for us to focus on vaping prevention efforts within that kind of overall context. So I thought that's really important as we're setting that up. All right, and I'm just going to check the chat because I see some questions that are coming in. I just want to make sure I'm being responsive. So hang tight for 1 sec. Great. One of the questions was just highlighting which of the strategies are evidence-based as prevention. And I think that's a really important question as we'll go through. And I'll highlight some of the ones that SAMHSA really suggests. So thanks for thinking about the evidence base around these programs, because I think that's really important. And as we're jumping back in, I'll check the chat in a few minutes here just so we can keep kind of a sense of the time. But I wanted to orient us to kind of the population data, because I think as we think about this, I really want to bring this issue to the forefront. And I know some of the previous presentations touched on this, but I really wanted to talk about it in the context of schools. So all youth and adolescents in schools nationwide, if we think about all of the students who are in schools, 7.7% of students, or 2.13 million, reported current use of e-cigarettes, which is quite a large number if you thinking about how many individuals that we would have to intervene with, 2.13 million. 10%, or 1.56 million high school students, and 4.6%, a little over 500,000 middle school students report current use of e-cigarettes. So when we're thinking about the prevalence rates here, we're seeing, of course, in high school, it's a higher proportion than middle school. And I would even argue for folks who are aware and work in schools that we're starting to see these trends even persist within elementary settings. And this is upper elementary. We're thinking fifth and sixth graders who maybe have access to older individuals in the community, like siblings, or just the ability to find these, whether it be in their own home or in other settings. So just thinking about the population data, knowing that this is an issue that our youth is facing. And I think in some of the previous presentations, Dr. Jason Burrows-Sanchez, I'm sure, mentioned about some of the trends and just the differences we're seeing almost overnight, over 1 year, with vaping being introduced. So when we think about these populations in general, we also have to wonder which populations are more at risk for vaping in general. And this is really important because when we think about the model, this MTSS model, the multi-tiered system of support model, there are going to be folks within that model who have a higher risk, who maybe we need to address these issues with in a different way. So I think that that's really important. And I do want to just refer back to the chat. I do appreciate Lori jumping in saying, the majority of students don't vape, and I think that is true. And I appreciate the the positive perception on that. And I think for the majority of students, we're having a positive impact. And I think when it comes to prevention efforts and the work that we're doing, it's thinking, how can we help the students who are most marginalized or marginalized within this? And so I agree that we are doing a pretty good job, but we have to make sure we continue to do that. And I think that's where prevention really helps. So when we think about populations at risk for vaping, we know individuals who currently use substances, students who are previous or current users of substances like tobacco, cannabis, alcohol. If they're currently using, we're probably going to see a higher likelihood, or they will have this greater risk. We also have to consider the family background. So this is students who are exposed to substances in the home setting, if there's family with mental health conditions, and parental gambling, just more at-risk behaviors. Seeing these things are correlated risk factors. Doesn't mean causation, though. And then mental health. When we know that students are experiencing one or more mental health conditions, when they've had traumatic experiences, which we can measure through the adverse childhood experiences or other measures, we know that this is going to be a higher risk. We also know that when there's emotional neglect or parental separation, that again, there's more risk. And so when we think about these factors, there are a lot of students in our schools who experiences those things. And then last but not least is peer influence. And this is going to come up a lot because peers are really, really valuable to other peers. And that is a huge driver for most students in their middle and high school experience. Students who report higher peer victimization or peer substance use are going to be more at risk. And so just thinking about these things, being aware of these risk factors allows you to provide a more differentiated prevention program for students that you might be supporting. And then last but not least, I want us to orient ourselves to this population of indicated students. And these are students who currently use e-cigarettes or vapes, and really providing interventions for e-cigarettes or vape users. This is that individualized person to person. And so what I think is really important as we're thinking about these kind of different presentations of folks around this prevention continuum, knowing we have individual students who are using currently, who we can help with prevention efforts, right? We can still help them prevent using anymore, or prevent them from using as much. And then we can also think about this all the way to that universal kind of school-wide prevention efforts. Okay, so let's talk a little bit about some of the statistics, some more of the data that we're seeing. And these data come from the National Youth Tobacco Survey, which I think is a really good resource for y'all. About 2.8 million youth currently use any tobacco product, right? And this is a little bit higher than the ones we were seeing with vaping, because the majority were vaping in some of the previous slides. Any tobacco use decreased among high school students from 2002 to 2003. And then any tobacco use increased among middle school students from 2002 to 2023. Some of the credit that is talking about this report is that this decrease, at least from high school, is driven by a drop in high school e-cigarette use. So our prevention efforts are making the impact that I think we would intend it to, or broadly speaking, for our high school populations. However, I think it shows that secondary students who are in middle school are very much at risk, right? It's a tumultuous time. I want to give you all a second to take a pause and think about your middle school years, 6th, 7th, and 8th grade. You're going through a lot of physiological changes yourself. You're going through a lot of social changes being a middle school student. You're starting to figure out things differently. And so I think that we need to be really tuned in if we're thinking about prevention, knowing that middle school students really need our help with figuring out strategies that work to help prevent these efforts. More than 2.1 million youth currently use e-cigarettes. That's a lot. We mentioned that decline in high school, which was great, and I hope we continue to see that pattern. But we also want to see that for middle school. More than 1 in 4 use e-cigarettes daily. So 25% of folks who do use e-cigarettes are using it every single day, which is, again, a lot. And for folks who maybe are less familiar, I'm just trying to bring awareness. Here are some of the most popular brands of disposable and cartridge-based products. And you can kind of see these in the graph here. The largest is Elf Bar with almost 60% of the market, all the way going down from Escobars, Views, Juul, and Mr. Frog. Almost 9 out of 10 use flavored e-cigarettes. So of the folks who are using e-cigarettes, almost all of them are using flavored e-cigarettes, which, as you can imagine, make it taste better. And so when the experience is more enjoyable, it can be perceived as less risky and be more fun. Okay, so knowing those statistics, I want to talk about the current landscape of vaping in schools. And so Dye and colleagues in 2021 conducted a study that looked at school personnel's responses to school-based vaping prevention program. And this was a qualitative study, meaning that they weren't looking at the numbers per se, but really looking at interviews and really trying to understand the context in ways that maybe some of the numbers can't shed light on. And so what they were able to glean from this study through their qualitative study was that youth vaping is prevalent in schools. And so although we're looking at the majority of students not using, it is still prevalent in schools, meaning it is happening, and it is an issue that affects other students within the environment, as well as the students who use. Schools are interested in prevention and cessation, but lack formal programs. And I think this is really where the rubber meets the road for so much of our school-based programs, is that our educators, who have probably one of the hardest jobs, are really burdened with so much. And so we really need to figure out ways that we can get great programs in their hands that they can use, or figure out ways we can implement programming that doesn't burden them more within the process. So I think there's a huge desire to help with substance use prevention, vaping prevention, mental health promotion, but trying to figure out a way that works within the system. So when we think about the perceptions of school personnel around vaping, which I think is really important, because these are the folks who are providing discipline, these are the folks who are creating policies. The prevalence from school personnel is that there is a really high rate, a high prevalence of vaping. It's a challenging and urgent matter. Vaping is done everywhere. So many folks might think, oh, it's just an issue that's in the bathroom. And we'll talk about some of the spaces, but vaping is really perceived as though it's being used all over school grounds. Other substances other than vapes are also an issue. And this kind of relates back to what we were talking about before about risk factors, especially for our youth who are engaging in other substances. Some of the types of programs and interventions that school personnel report through their study that they received were sporadic lectures, which we know are just not effective. The research shows us that for professional learning in schools, those one-off sessions are not really going to build anything. We need to have strong reoccurring sessions that really allow for discussion, allow for follow-up. And so we know that multiple session training is really going to be important. So if we're really serious about school-based prevention, there's a curriculum, and it's embedded within instruction so that teachers feel like they can do it and they don't have to create the lessons, which I think is really important. And I'm just checking the Q&A. I'm going to address a question. I'm just going to finish this slide, but I appreciate folks who are jumping in with these great questions. Okay, so the other piece is the lack of comprehensive programs. We can't really have a one-off program where maybe in fourth grade, they're really honed in on this, but there is no access to programming from kindergarten through third grade. Like that would be a huge miss when we're thinking about prevention efforts. We also have to know that the school administration, the district has to be supportive of these efforts, because if you're a really innovative administrator trying to do restorative practices for vaping prevention, you have to make sure that the district is on board and that the policies and practices that have to be implemented are consistent with what is best for the student. And then other programs and intervention that may happen is just other substance and behavioral education. So a lot of this is psychoeducation in nature. A lot of this might be the types of support that they could get from districts or school teams, but it's not standardized, and there's not really a roadmap that I think is really clear for educators when trying to deal with these issues. One of the questions that popped up in the chat that I think is just great is, at what point do parents have to get involved? In order to access the quit line for cessation products, is there any follow-up therapy for post-vaping? And these are all excellent questions. And when you're working in a school setting, the general rule of thumb is that you want to involve parents as much as possible for transparency, for engagement. We know that the #1 predictor for student success is parent engagement within their education. So if you're going to have a vaping prevention program at your school that's a universal program, get parents involved in it. Have parents be able to help support getting the word out. Maybe they're involved with going around to classrooms and getting people ready for the presentation, or messaging other folks in their community. This would be a great thing for the PTA. But then when we cross the line to think about more targeted and individualized interventions, that's when you're going to need to get more of a parent consent beyond just things that are universal for the school. Anything that's universal generally does not need parent consent, because it's within the bounds of the decisions that the district's making, that the school's making. It's when we really start to target different strategies. So I would call that tier 2 or tier 3 type supports, which we'll mention. And I think it's critical, if not integral, to have parent involvement within the process, or at least attempts to get parent involvement. All right, and then another question that came in, which I think really relates to the many of the kind of universal supports we'll talk about, is how do you stop the shame and stigma and get the youth to come forward? And this is such an important question, because I think, if we could wave a magic wand and say, kids just won't vape in schools, that would be great. But the reality is, it's about us creating cultures and climates of trust, and where people have shared values about what they do and do not do in schools. And I think that's the hard part too, is that there at least is this pragmatic piece, right? There are spaces you can't use substances, and it's particularly problematic if you're underage and doing those things too. So I think the best way to stop the shame and stigma is to stop creating shame and stigma around the consequences that we provide for students when they engage in these behaviors. I think about the adolescents that I work with, and their frontal lobes are still developing, as we all know, and they make really bad decisions. And so I think about all of the bad decisions I've made in my life, and if I wasn't always met with a constructive lens, I maybe wouldn't have been able to be resilient and to feel more comfortable, to be forthcoming about my mishaps or errors or things like that that I've done. And so I think it's a really complicated issue to reduce the stigma, but I think we can start by destigmatizing how we respond to these issues. And then just a great response here in the chat too from Shannon. Kids who use nicotine become addicted to nicotine. It's one of the most addictive substances. It's the most addictive substance. So we know that it's hard, and it's really hard work, especially if they're doing it younger. Okay, and thanks again for all these great questions. I'm gonna table some more of them just because we have so many coming through a little bit later in the presentation, but I really appreciate all of the engagement from you all. Let's talk a little bit more about perceptions of school personnel. So we know that the dissemination of education can be in a variety of ways, and that they're getting this through guest speakers, social media, personal conversations, big presentations at conferences, posters, and then student-led initiatives, which are really nice because I think one of the best ways to create positive climates around these issues is not having the educators, the adults in the building saying, don't do these things, but rather having peers who students respect and value and trust and appreciate, saying, that's not for me, I don't do that. And I think that the power in that is so much more. And then there's also this inconsistency of measures. I think one of the biggest issues is if parents are or not informed around some of these prevention efforts. Like I said, it takes all of the community, including parents. Also thinking about what are the types of consequences. Are they light or moderate? Are they severe? Are there screenings that take place in school around substance use, like that are at the universal level? And so all of these are really important points, but that don't have a clear path that schools have to follow. And so I think we're going to try to address some of these through the presentation today, but like I said, it may not be everything. So if you have questions, don't hesitate to reach out after this presentation. This next slide really talks about the perceived barriers and the resources. So some of the perceived barriers is the lack of time, interest, which is unfortunate because I think this impacts all of our students in some way, whether they're directly using or they know someone. Some of the barriers around knowledge and also the coordination of efforts. I always like to think that when the issues break down in our community or in our schools, it's not necessarily, it's less of the interest piece and mostly of the knowledge, of the coordination, the lack of time, the funding. Some people do get discouraged, and I think that's a reasonable response when you're showing up wanting to take initiative and can't do things. Also, I think some of the barriers we see are outdated material. I think even thinking about the programs that folks use to reduce vaping is going to be really important, and are we staying contemporary with that? Because we know there are programs that don't work. And then the ease of access to substances. And so thinking about how close is a store that sells vapes to a school. I think these are things to consider. And then also just the resources, evidence-based prevention programs, staff training, community engagement. These are the strengths, right? These are the things that we can lean on to build resilience, and that we really should, I think, through doing this work. Okay, so what are the challenges broadly to prevention? Because I think we know that in this kind of pie in the sky, we're going to create this framework, we're going to implement it in schools, and everything will be amazing. But there are challenges, and I think it's really important to address those. So first and foremost, there is a ton of vaping in our community, right? And so when we're trying to create an environment, trying to create a universal approach that vaping is bad for our health, it's bad for us to use. It's hard when there's this kind of social comparison that's always available with people vaping all the time. I know for my young children, I have a 6 and 9-year-old. They go through a vaping prevention program through their school, and they're always quick to identify people in the community who they see vaping and are concerned about that and concerned about them. And so I really appreciate where they're coming. It's not a place of shame, but mostly just concern, which is really interesting because a lot of the education hasn't necessarily come from my home, but from the programs at school, which I'm grateful for. Access and availability of vaping products. Like I mentioned, folks may be able to get these products at home. They may live close to a place. Their school may be close to a place. So they might just be able to have an easier access point to the substances, to vapes. And then there's cultural considerations around values and attitudes and perceptions of risk and normalization of these products. And so really trying to understand communities that you serve and what is the precedent and what are the thoughts around these devices. There's also the challenge of marketing. I think that we are faced with companies who produce these products making money. And I think that goes, against our efforts to try to prevent folks from using. And then just the perceptions of vaping as low risk. Oh, well, I'm not, combusting anything. There's no fire, and it's safer, it's healthier. Well, there's more and more research coming out that is the contrary. And I think that's something to really consider, because we know perceptions is a really big part about the prevention process for our youth. And so if students are seeing a low risk in the way that they perceive it, that's going to influence their use. And then, of course, the regulatory environment, which I think is really important to consider, because that's going to be a driver for some of these other pieces that we mentioned. You know, what can we do? What can't we do based on these circumstances? So what are the current policies to address vaping? O'Connell and Kephart in 2020 looked at the local and state policy action taken in the US to address the emergence of e-cigarettes. And really what they found was that e-cigarette classification, they were able to kind of find this, this definition for it, which can be used as either a consumer product or a medicinal product. There's also some smoke-free air policies, bans e-cigarettes and aerosol and non-smoking areas, which you've probably seen in other spaces. I know at the University of Utah, they've updated all of their smoke-free signs to also include vaping. There's also the opportunity for policy change around taxation. So there's increased price at the point of sale. So, hey, if you're going to purchase this, it's going to put a bigger dent in your wallet as a deterrent from doing these things. And then there's age restrictions. We see the raise in minimum age of sale to 21 years, which is really, trying to deter folks, because what we know is if we can delay folks from vaping and using substances as late as possible, it gives more time for their brain to develop and to be able to recognize the risk that's associated. We've also seen flavor bans, a ban in all vape juice flavors besides tobacco and mint. That way it becomes less of a desired product. So you're kind of removing the fun, exciting parts of it, at least the perceived fun and exciting parts of it to the users. There's also the retail licensure and sales restrictions, which requires retailers to have a license to sell e-cigarettes over the counter. And then advertising. It regulates promotional channels for ad content and packaging, prohibits packaging to resemble food or candy, and requires nicotine warning. So we're not trying to make this fun and exciting for the buyer, for the consumer. And so these environmental changes that are due to the policy changes are really important, because they really will help guide our behavior and our strategies that we can use to help address vaping prevention. We also know that there's jurisdictional policies around licensing and zoning. So which stores could be close to schools or other locations, which really helps, right? If you're having a school that's within walking distance from places that are selling vape products, it really can increase the accessibility. Okay, so now that we're kind of on the same page with some of these MTSS issues and some of the kind of basis behind them, I want to switch gears and now really talk about how we can do different elements of vaping prevention at the different MTSS framework levels. So let me orient you to this triangle. We're going to keep this going through the rest of the slides, just so you can kind of reorient as you go through. I'm sorry for folks who have seen this triangle a million times. You're probably nauseated now. But for folks who haven't seen it, this is the multi-tiered system of support framework. What it really speaks to is creating a differentiated prevention model where we can allocate resources to those who need it more efficiently. Tier 1 is universal school-wide prevention programs. This is for every single student in the school. 100% of the students are going to get these prevention programs, and it's meant to be broad and informative. Tier 2 are targeted prevention or interventions for high-risk populations or students who might be at risk for vaping. And when we see these types of Tier 2 or targeted prevention efforts, typically they're informed by screening. And so what we'd like to do is use screening efforts around risk at that universal level to tell us, hey, these students who have scored on the screener in a more elevated level, we maybe need to follow up with them and understand more about what's happening. And at that level, we can provide small group interventions. We can provide targeted web-based modules or e-learning, and those can really help to really address those students who have that need that may be kind of on the fence. They're at risk for developing more issues, but maybe not to the point where they're using frequently or daily. And then Tier 3 is this individualized interventions, and this is the indicated population. These are for folks who are currently using, and we really need to create interventions. So if 100% of the students get Tier 1, we expect about 15% of the students in this whole school population are going to need some higher level of support, and that's where tier 2 might come in. And for those students who have now been addressed at the universal level, at the target level, there are still going to be a few who need more individualized support. And these are folks that we're going to triage to that service at the top of the triangle. And remember, these services are built on one another. So if you're getting individualized services, you probably have already gone through a targeted prevention intervention, as well as the universal school programs that exist. Okay, so let's jump in, talking about universal prevention. Remember, this is for everyone. We're creating an environment where vaping is not likely to occur, and that's not easy, especially with all the issues we mentioned before. There are a lot of environmental deterrents that I think we've seen. Some of those in schools are new bathroom detectors that can detect even small amounts of vapor content. We also know that there's video recording in non-bathroom spaces across most schools now. So public spaces within the school that are not private are recorded, and we can kind of follow up and see what actually happened. We also know that there are things like school discipline policies and practices, similar to our legislative policies and practices, that consecrate the use of vaping and promote prevention. And we're going to talk a little bit about school discipline as it relates to restorative practices in a little bit. We also want to think about school positive behavior support systems. These are those universal structures that really promote positive interactions within the school. And if you're thinking about how do you reduce stigma, how do you create a different environment, well, it's making school seem like a place that is enjoyable and fun and connected. Those are really important things, and easier said than done. And then last, we can also have school-wide vaping prevention programs, which can really help us to address school-wide needs and really bring awareness, help to address the needs of most students, who really, those programs will be sufficient. And if we think about these universal prevention programs, I'm going to highlight a few that I think are really well done and that have some great support through SAMHSA. And so I have links on here, but I'm also going to, for a few of them, share my screen so you can see just a little bit about what those programs entail. So this first one's called Catch My Breath, targets school level programming. It's community-based intervention involving students, parents, school personnel, which I think is nice, kind of has that whole ecological framework. And there's this administered during 4 health lessons throughout the year. So this is like an integrated approach. And it's really about increasing understanding of students that vaping is not harmless, that there is a risk associated with it. And I'm just going to switch my screen share here just to show you a little bit of what that looks like. So this is a web page for Catch My Breath, and it's an evidence-based youth vaping prevention program. Again, SAMHSA has recommended it, and you can get the program. But what I'm going to highlight for you all today is just this is a brief video. It's about a minute long that can just kind of highlight and give you some insight about what a prevention program school-wide that is integrated could look like.
Using nicotine can make you feel dizzy, nauseous, confused, and nervous. Let's make ourselves really small and go into the aerosolized vapor.
This generation will be the generation that says no and does not allow substances to control the user's life.
Peer-reviewed study found that schools that implemented the Catch My Breath vaping prevention curriculum had about half as many 7th graders try vaping the following year.
All right, thanks for following along that one with me. I'm just going to switch back to the slides. And I think that, that's a great program. I really love that the parents are involved in it. I think just having resources that are easily accessible like that are really important. Okay, another one when we think about universal prevention is the Truth Initiative. And this one is another brief clip I want to show you that just talks about this. And if you'll notice, a lot of these are these web-based modules that are easy to integrate within curriculum that are meant to be just, ready to use.
Today, 1 in 5 high school students are vaping e-cigarettes. The Surgeon General has declared it an epidemic. Now, Truth Initiative, the nonprofit behind the nationally recognized Tobacco Prevention and Education Truth Campaign, has created Vaping Know the Truth, a first of its kind digital learning curriculum available free to schools nationwide. It's prevention focused to keep students from starting. And for those who are already vaping, the curriculum links directly to This Is Quitting, the only proven effective text message program designed specifically for youth and young adults that is already helping hundreds of thousands on their journey to quit vaping. Whether in class or at home, students will complete 4 self-paced lessons. Students will learn the facts about e-cigarettes, the history of tobacco companies' manipulative marketing tactics, the dangers of nicotine addiction, and keys to self-care and quitting. Just as important as what students learn is the unique way they'll learn it. Vaping Know the Truth deploys peer-to-peer video, engaging quizzes, and a format that allows students to go at their own pace, and is delivered in Truth's authentic youth voice. The program was developed together with Kaiser Permanente and Everfi, and in collaboration with the American Heart Association, trusted voices in youth education and health. Vaping Know the Truth is already helping students across the country. Youth vaping is a problem, but we have a solution. Working together, we'll make smoking, vaping, and nicotine a thing of the past.
All right, thanks everyone for watching those clips with me. As you can see, they're really geared towards secondary students, really trying to be really accessible, really engaging, and again, like having that peer-to-peer voice, not necessarily having their teacher tell them those things. Okay, so that's primary universal prevention, right? We're thinking about everyone in the school can get access to these modules, parents can get involved. It's really an accessible tool for everyone, and creating that culture, that we don't use in schools, we don't vape in schools. We respect this space. This is an extension of another space that we respect. Moving into targeted prevention, this is at that second tier. These are for students who are at risk for vaping, and that may be for a variety of different reasons. We mentioned a few of them before. In this targeted prevention efforts, we're seeing small groups of students, and these students receive a similar non-individualized prevention program. And so what do I mean by that? Well, true tier 2 efforts, or these targeted efforts, means that we are not individualizing, because when we need to individualize, that's tier 3. And so in a way to work smarter, what we're saying is that these interventions will help with prevention efforts for all students who show similar risk. And some of these supports could entail group vaping prevention. So you might have a group of students who all show similar risk. You may have web-based prevention programs, which I'll show you another one in a second here. We also have peer support, which I think can be extremely powerful. And then school engagement. I think the more we can get students involved in extracurricular activities, engaged in their school community as a whole and their academics, it's going to have a real positive impact and a reduction of these risks that we know will make it more likely for them to try vaping. One of these interventions that I'm going to show you, and I'll show you a couple just to kind of give you a sense for these targeted prevention interventions. One is called Smokescreen, and we would see this as like a video game self-regulated learning, and it's really focusing on interpersonal and consequential characteristics of vaping. And the existing research supports this intervention as an effective tool targeting aspects of prevention. So let me share my screen again and show you a little bit about this one.
Smokescreen is a game about building a personal network of friends, family, and acquaintances while dealing with people who don't always do the right thing, like using tobacco or vaping. In Smokescreen, you are the new kid in school. Your job? Make friends and find cool people to hang out with. Be a successful student and achieve your dream of going to college. There are lots of interesting people you could see being your friends, but you have to be selective. Some people will help you move forward with your goals, but others may hold you back and tempt you with unhealthy choices, like smoking cigarettes. You will face situations where people want you to join them in their poor decisions. And sometimes friends just need your help as they face a tough choice of their own. You'll have to decide whether to go along with them, convince them not to make those choices, or reevaluate your friendships. Smokescreen makes you more aware of how people influence you and how to influence others in ways that can make everyone healthier and happier. Be more prepared to deal with choices that aren't always as easy as they seem. Play Smokescreen well, and you'll make healthy friends for life, creating amazing high school memories and be on your way to a brighter future. Smokescreen is developed by Yale's Play to Prevent Lab. For more information, visit smokescreengame.org.
All right, thanks everyone for checking that one out. I really like that one, especially the game-based learning elements. I'm a huge video game geek, so I really enjoy the opportunity to embed learning in really fun ways like games. So something like that seems like a really applicable way, especially for our students who maybe might be at risk and we need to have a more targeted approach. Another targeted intervention that you all may consider looking into is the American Lung Association's NOT program, which is not on tobacco, and it really dovetails from the Vape Free Schools initiative, and really talks about kind of being able to achieve resilience through self-paced modules that students can complete. And this video here is a little bit longer, so I'm just going to skip it for the sake of time, but if you do want to check it out, you can follow this link. But essentially the users go through this course that you can see here. It's kind of like a game board, and they're tasked with different environmental experiences and kind of interactions that they have to complete. That really help learn and help with the overall prevention efforts for vaping, similar to the one that we saw for the last one. And then for our last targeted interventions I want to highlight are just some of the work from the Stanford Medicine Tobacco Prevention Toolkit. This is I think a really great curriculum that we can use. There's some online features and there's some like toolkits, modules, things like that. And so again, I'm not necessarily endorsing any one of these three, but I want to give you options so you can look through and say, what makes sense for my school community? Maybe it's none of these, but I know these are just at least starting points that can get you going, especially if you're in a crunch to start doing these efforts in schools. All right, let's switch gears and talk a little bit about our individualized prevention efforts. These are the services we're providing for folks who are indicated, meaning that they're already using. When we have individual students, these are when we might see therapeutic supports, we may see other community connection, as well as other services. It's going to be more effective for achieving positive outcomes for risky behaviors when we're really individualizing our services. That's how we really can make change for those really high need situations. It's definitely going to be a higher cost and a use of resources to implement, but that's why if you're working smarter in this system that we've developed with our MTSS framework, then the number of students that you need to address with these individual supports is far fewer than those you'd be serving at other levels within the continuum. And again, we want to focus on characteristics and risk factors of individuals such as knowledge, attitudes, behaviors, self-efficacy. We want to build resilience, build knowledge, create healthy perceptions, and engage in healthy behaviors around vaping. We also want to teach our students who are receiving these individualized prevention services, we want them to learn practical techniques for resisting peer pressure to vape, because that's going to be a main way that individuals are accessing is through peers and through pressure from their peers. And so things that we would like to teach them in these more individualized settings. And again, these are things that, in my opinion, I think our excellent school staff can help provide, like school counselors, school social workers, school psychologists, folks who are already working in schools, or if you're a private agency, maybe you collaborate with schools to help provide some of these supports to students as they come up, because again, that's going to help prevent the need for maybe access to more intensive services in the community later on. So again, we're going to talk about assertive communication, refusal skills, identifying supportive peer groups, which is so important. Who you hang out with, that's such a big factor. And then making informed decisions about their health and well-being. I mean, these are adolescents who want autonomy, and so we have to let them know that you can have that autonomy, and the choices you make have implications for better or worse based on how you choose. And then really digging deeper and understanding what is the context for vaping. Why are our students engaging in these behaviors? Why are they using at school? Why are they trying to do it in these ways that maybe could get them caught? We have to understand these things, because that context, if we seek to understand that context, we'll know so much more about social determinants. We'll know so much more about the individual contextual factors that the student may be experiencing, mental health concerns, trauma, those kind of things. And then we can start to peel back the layers and realize that maybe, especially for some of these individualized prevention efforts, our students are needing a lot more, and that their use of substances or vaping is a symptom, a way of handling a symptom that they're having, and trying to self-medicate in some way. So, trying to take that sort of non-judgmental, non-stigmatizing hat and say, how can we help this person? How can we understand their context to help them? But that really brings us to restorative practices, which I think is such an important piece to all of this work. When we think about vaping prevention in schools, if we want people not to vape in schools, then we need to make them feel like school's a connected, enjoyable, efficacy building place where they can leave it and feel good about themselves. I think that many times our practices in schools when students vape and are caught is that there's some very punitive consequences, where they're suspended, where they're given more opportunity essentially to engage in the community and access things, when really what we need to do is say, we want you to be here. We care about you. It's important for you to be in this space, and that you're in this space without using vapes, because we care about your health. We care about the health of everyone around us. And so maybe the restorative practices are going to be tied to making it right. And in some of the best ways that I've seen this in practice is if individuals are, caught on campus using vapes, that there is some restorative piece, whether they're cleaning a bathroom or they're helping to make it right, to show that there is some labor, but that labor is constructive, and that you're doing that because you want to make it right for the people around you. You respect and value the people around you. And that's what restorative practice, I think, in my opinion, can really do so well. And so one of these interventions that I really want you to consider that I think has restorative justice and restorative practices in mind is intervention for nicotine dependence, education, prevention, tobacco, and health, or in-depth. It's an alternative program to systems in place for suspensions or citation due to substance use in school. So it's taking this out of it and saying, instead of just kicking kids out of school for a few days, marginalizing them more, ostracizing them, and giving them access to spaces where they're more likely to access vapes or even use vapes, let's keep them here. Let's support them. Let's give them compassion. And the way that the in-depth program works is that the schools connect with the American Lung Association. They complete this facilitator process, which does have some cost associated to it. But then the facilitators prepare and implement the in-depth program. And what they've found is that it's able to reduce risks for students and increase the chances that they'll be able to achieve their goals. Now, this is because they're met where they're at, and they're supported rather than shamed and ostracized. And I think that's one of the biggest things. I have students who I support in schools who have used vapes, and they'll make poor choices. But when they come back to the school, if they are suspended, because sometimes I can't control for those things, I'm always letting them know that I really am glad that they're here. And that in the events that I get the chance to do some of these alternative programs with many of the school districts I work with allow, it really shows the respect that we have for the individual. Again, that they're kids and that they're going to be making really bad choices until they get older. And so if there's anything I can leave you with for this presentation for prevention is see the students where they're at and seek to understand and know that there's a lot that we can do before students get to that place where they're using frequently. So with that, I'm going to switch over to this slide that just has a little bit more information. A lot of the work that I do is around teleconsultation in schools, so using telehealth like this to work with schools around various issues. If you're interested in checking out the text that came out in January, you can scan that QR code, or if you want to get in touch with us, our contact information is here. So with that, I want to thank you all again for your time. This was awesome. Thanks again for all your engagement.